When lockdown first started, I definitely struggled with feelings of loneliness and isolation.
First year was pretty grim.
Initially, I thought, what a great time to actually just pause, reflect, and have a little bit of quiet time, me time.
Pandemic was like a very hard time for me. I suffered with depression and anxiety.
Having people to hang out with and be around and spend time with, usually as a coping mechanism, wasn't entirely there.
The thing I missed most was the interaction with my grandchildren, getting a hug from people you love.
I think over the last 2 years, I think there's even been a mindset shift with respect to how important it is to just focus on your mental health.
Hey Jan, it's the last show of the season, and it's really nice to be hearing the sounds of laughter from kids.
It feels like summer. It's also amazing what we were able to accomplish from the topics we covered, from housing to education, and now to what many people consider the shadow pandemic, mental health.
I think one of the most interesting things about the pandemic, a silver lining, if you will, is that because we're going through something at the same time and we're all asking the same questions, there's been a lot of fear, feeling out of control, and it's pushed the conversation about mental health to the forefront. I saw corporations, like on Twitter and social media, talking about mental health, things that maybe things you wouldn't talk about at work, and these conversations actually coming to the forefront. It's been fascinating.
It's not even just corporations. I've never heard friends and family talking about their mental health and their mental well-being and what they do. So it seems like we're normalizing that conversation about mental health. Speaking about friends and family, you do have 2 kids, and I'm curious, the pandemic has really shifted impacted their mental health. What has it been like for you?
At the beginning of the pandemic, it was really challenging when we were doing online learning and we were broadcasting from home. I actually ended up sending a message to the teacher, one of my kids' teachers, saying, listen, I'm doing the work. I can continue to do it, because it was really hard for me to work and sit beside my child, teaching them how to use the computer. Mommy, how do you spell, I don't know, storm? And it's like, I'm trying to work. But being able to work from home was a privilege. There's a lot of us who weren't able to work from home, and we still have to navigate the pandemic the same way.
It's interesting, we have that conversation about work-life balance. This is great, we can work from home, but then it feels like we're really connected, maybe too connected. So it'll be interesting topic to sort of see how we can sort of balance that out for our mental health as well.
Yeah, I kind of miss working in the office just for the simple fact that, in the before times, if you came to work and you were feeling a little off, your colleague could read your body language. But being at home, it kind of felt like you were intruding other people's spaces by saying, hey, on Teams or on Zoom, I'm feeling a kind of way. And so I miss that aspect of it.
It's okay if you say you miss me. That's fine.
I did miss you, Jan.
Okay.
The pandemic did bring the conversation around mental health to the forefront. But I think the question we should be asking ourselves is, are we all right? Hey, Aaron, it's nice to see you in person again.
Great to be here, Nam.
I don't have to bring up the fact that we've been in a pandemic over the past 2+ years. When it comes to mental health, what does Polly find about the conversations it's opened around mental health?
This is what I thought was really fascinating. In the beginning, there was a lot of distress, and it was the same people talking, but expressing more distress now because, of course, of the increased isolation and also anxiety over health and well-being. We saw increases in eating disorders, in domestic violence. But in the second half of the pandemic, the conversations changed dramatically.
In what ways?
So in the second half of the pandemic, we saw the conversations become much more positive. Some people saying they'd been suffering quietly for decades with mental health problems, now saying there's more acceptance. Especially in the workplace, we saw a lot of supervisors reaching out to their staff, asking how they're doing, giving them mental health days, those types of things that didn't happen before.
So would you say then that the pandemic, one of the silver linings was that we kind of changed that conversation to more of a positive one?
Well, I'd say the issue around stigmatization of people with mental health problems is getting better. It's not where we need it to be. But here's the kicker. It opened the conversation for adults, but interestingly enough, it did not open the conversation for children. Children got worse during the pandemic.
With the lockdowns and learning online?
But also because children are not as well versed, they don't have exposure to what is mental illness, when they started feeling the symptoms of mental illness, they didn't know what it was and they were afraid of it. So they didn't talk to their parents about it and they didn't have friends to talk to about it. We saw a huge increase in eating disorders among young people, and not eating disorders because they wanted to be thin, but because they had so much anxiety about losing their friends, falling behind in school. And parents were saying, why is it that at my workplace, I can have mental health days, I can call my boss and say, I'm taking a mental health day, but my child can't go to her teacher and say, I'm just taking a mental health day.
What does Polly find around resources for children and mental health?
Mental health resources for children are completely inadequate. So parents are talking about really, really long wait times. And if your child is suffering from malnourishment, from anorexia, you don't have time to wait.
To go on a waiting list.
The essence, yeah. I mean, you would never dream of just not going to the doctor for years and years. Why would we not treat our mental health the same way? Because it does have huge impacts on your life.
What does Polly see when we talk about mental health and the workplace?
So we see some employers are giving, very proactively giving employees mental health days. And interestingly enough, people are saying in some workplaces where they actually work in the mental health field, they don't give their employees that. And they actually expect them to work, because there was, a lot of inflow on mental health issues during the pandemic. They expected these people to work overtime,
the demand,
dealing with mental health issues, but not looking after the mental health of their own employees. So it's very, very uneven.
What about the connection between mental health and the opioid crisis? Because the opioid crisis has been called a shadow pandemic.
Now, conversation about the opioid crisis did dip during the pandemic, because I think there was just so many other things, and people were facing their own crises at home. But there's definitely a lot of people are saying we have to start looking at the mental health aspects behind addiction, and the opioid crisis being key to that. And people feel very strongly that the government did not do enough.
British Columbia made huge news across the country when they decriminalized small amounts of certain drugs. What did Polly pick up around that conversation?
People were really, really positive about what British Columbia did, and in fact, people think we should expand that by decriminalizing some narcotics, such as opioids, it might encourage people to come forward and get help when they need it.
I remember once upon a time where people didn't say anything about their mental health, and the fact that now people are having these conversations online shows that maybe we are moving forward in some way.
Absolutely. The good news is it's going in the right direction. We're not there yet, but it's definitely going in the right direction.
The pandemic has taken a toll on all of us, but if you're an essential healthcare worker, you've been expected to show up every day, regardless of how COVID has impacted your patients, your family, or even yourself. If you're a frontline healthcare worker, how has the pandemic impacted your mental health? We're here in Etobicoke to find out.
My name is Nancy Halupa, and I've been an emergency room nurse in Toronto for 23 years.
Can you describe what it was like when the pandemic happened? You're in the mix of it. What was that like?
I've always only ever done emerge, so I can handle the chaos, and I thrive in the chaos. But it was different because we weren't seeing that much tragedy, because they were dying, and they were dying fast, and they were dying alone.
Were you scared at all?
I wasn't really scared of me getting sick. I was terrified of bringing it home. So we would literally strip down to our underwear in the front of, I would strip down in front of my house and go straight to the basement and shower. And I lived in the basement for 6 months. I didn't come anywhere near my family. So it's actually really weird talking about that now.
Yeah.
I wouldn't eat dinner with them. I wouldn't see my parents at all.
That must have been really hard. Can you believe that you did that for 6 months?
No. I'm really close to my parents. But my dad's got health issues, and the thought of me giving him something that could kill him, I just couldn't live with myself.
That must have taken a toll on you, because when you go to work, you are helping other people that
Yeah.
need your help. And then when you come home, where you're supposed to have support.
Because I had no physical connection with anybody. I couldn't get a hug from someone here. We became really close at work with the core people that we worked with, because we didn't care about hugging each other. Mm-hmm. You know, we were all in the same place. And so I did a lot of my caring and like hugging and stuff I did with my patients or my friends at home, mm-hmm. at work, because those patients needed that. They didn't have their own family there.
What do you think that meant for them to be able to have you in their final moments?
I'm going to be honest. I've always kind of thought that patients who are actively dying know that there's someone there and they can hear you. It's maybe it's not true, but it's how I kind of get through my shifts. Mm-hmm. But these ones, it's like you knew they didn't know anyone was there because they were so sedated. And so I don't know if they knew we were there or I was there, but I knew I was there. And most of us would say, I'm not going to leave them here to die alone.
Do you feel like maybe we took you all for granted?
I think nurses in general have been taken for granted for years. My whole profession has been an under-respected profession for years. And then when COVID happened, you know, we're heroes, we're this, we're that. We're still not appreciated.
And do you think that Bill 124 added injury?
Oh, that added insult to injury, mm-hmm. way before the pandemic. You know, but then the pandemic happened, and despite Bill 124, we all went into work and we all worked our butts off with extra shifts and staying late, and he just called us heroes but capped our wages. Like it was a slap in the face.
There was a protest at Queen's Park, and your son had a sign that said, "My mom cries after every shift." There seems to be this kind of narrative that you're invincible. Mm-hmm. You're not.
We're not. I'm definitely not. I mean, this pandemic broke me.
In what ways?
I didn't realize how unwell I was until I was assaulted and had no choice but to walk away. The anxiety going into a shift, I mean, I think I've always had that, but the anxiety of going in and not knowing how many patients am I going to have to bag today, or how many times am I going to have to call the morgue truck to come and get the bodies because our morgue is full. It broke me. And, you know, we're used to seeing maybe 1 or 2 patients die a day. Sometimes you go a shift and not see any of them die, but the last 2 years you were literally bagging bodies 4 times a shift.
This is not just stuff that you carry on your own. Your family also carries it.
They do.
What's the impact been on them?
To be honest, my family was thrilled, not that I got assaulted, mm-hmm. but thrilled that I was finally given a chance to walk away and take care of myself for once. Because I try not to cry in front of my kids, and I come home and I try to tell them the funny stories that happened in the Emerge or the good stories. I don't tell people a lot of the bad stories because I don't think people that aren't in it should know it. Every patient that died, it's like I remember their face, and I remember having to talk to the families to say, you know, they're not doing very well. It just broke me, honestly. I feel like I could no longer care for patients the way I was trained to care for them. And if I can't leave my shift with a feeling of pride that I did something good, then it just seems not worth it to me to do anymore. You know, we're treating patients like cattle, just one after another, bringing one in. You know, somebody dies and you're getting yelled at because they need the bed. There was no dignity for these patients, and there was no dignity for me in treating them that way. So I think the burnout came from that.
So you're saying that as a nurse working on the front lines and seeing all the death that you're seeing on a regular basis, you didn't have access to mental health care?
Yeah, we had the AAP cards. That's about it.
But that's calling like a stranger. That
Yeah, I was never full-time, but the benefits only cover $800 a year for nurses to do any kind of therapy. That's like 5 sessions at the price that they are now. So you don't get anything done in 5 sessions. I remember calling my mom one night at 2 in the morning because someone died, and she just, she didn't know what to say, but I had no one else to talk to at the time because I was the most senior nurse working.
Have you thought about leaving nursing?
I feel like I'm nothing if I'm not a nurse. I was a nurse before I was a wife. I was a nurse before I was a mother. It's my identity. It's what I've wanted to do since I was 6. So I have no other skills. And I just feel like if I quit and not go back, I've just wasted 24 years of my life. So it's a hard decision for me to make.
Charlene, it's really nice to meet you.
Hi, Nam.
I think at the beginning of the pandemic, when all the long-term care homes were essentially in lockdown, I think people kind of understood, and we were trying to protect our most vulnerable. But as the pandemic progressed, and it seemed as if nothing was really changing, how did that impact loved ones?
We saw the highest rates of resident mortality in the world when it came to long-term care. And so we had this trifecta where we had staff who were working in long-term care, suffering moral distress, compassion fatigue, burnout, extreme exhaustion. We had residents who were socially isolated for their own protection, not able to leave their rooms, not able to have any contact with the outside world. And you had families who wanted nothing more than to go inside to the home and provide care that they were so used to providing, and they were unable to do that.
There was a lot of people who died in long-term care homes. Loved ones weren't even allowed to be there for those final moments. What does that do to someone in the long term?
We've interviewed family caregivers in Ontario and in BC, and they spoke about how this is the worst thing that has ever happened to them in their lives. The long-term care home system is there to provide care for the society's most vulnerable, and we were not able to do that in a way that was safe. And so we saw deaths upon deaths. We saw, horrific conditions of work. We saw terrible care, and these are not conditions that we should be complacent about. This is a system where we house older adults, and often they can be forgotten about. We accept low-level cares for this population, but also the staff that work there often are female, often are racialized minorities as well, who are getting paid very low wages. And so you have this perfect storm. And within this storm, you had an exodus of staff.
It felt as if some of the decisions that were made keeps the physical safe, but there's a lack of understanding of the long-term mental impacts. Maybe it's an indictment in our society of where we place mental health that maybe is secondary to physical health.
Early on in the pandemic, we created through these lockdown policies competing crises. We had a COVID-19 crisis, and then we also had a social isolation crisis. And residents were socially isolated to their rooms. They were not able to leave their rooms. They were not able to go outside. So these were, conditions that were akin to solitary confinement. We saw residents experiencing symptoms of confinement syndrome, which is something that you would see in prisoners.
Can you explain what that looks like?
So confinement syndrome is the condition that you would normally see in prisoners that are in solitary confinement for prolonged periods of time. Extreme depression, withdrawal from society, breakdown of communication. And so we were seeing this syndrome in many of our long-term care home residents because of the social isolation.
We saw technology being, used as a placement for those caregivers. Did that help the people in long-term care homes, or did it make it harder for them?
What we saw was that technology was not a substitute for face-to-face, in-person care or visits. So number one, a lot of homes didn't have iPads or they didn't have tablets to even use. And during that time, there was concerns around sharing devices from room to room from an infection control perspective. So these homes didn't have the infrastructure to even support the use of tablets. Family members would wait all week to have their one video call and not actually have that video call because it was canceled last minute.
What lessons have we learned that we can hopefully rectify the wrongs of the past 2 years in long-term care?
I'm not sure that we can rectify the wrongs. I think that we need to move forward with an idea that long-term care is a sector that needs more support. So whether that be more funding to provide more staff and more support for residents to have a higher quality of life. Also from a practice perspective, that we move forward with a trauma-informed care approach. I think a broader context of this too is the fact that there's also a really strong profit motive that is involved in long-term care too. So even if the government provides millions of dollars to long-term care, a large proportion of that is going to for-profit homes. So that's always going to be there undermining potentially improvements in long-term care. We need to provide people with that choice and with the dignity to age in their own home and to age where they want to age.
At the beginning of the quarantine, I haven't seen any friends for like about half a year, and it really affected me.
It was really hard, and online school was not fun either.
It's definitely been overwhelming.
When it started, I kind of didn't really talk to people a lot.
Sometimes it was hard because it was like online and then in school and then online and then in school.
My parents were stressed out and stressed me out.
It's definitely taken a toll on my mental health.
We know that the pandemic has impacted everyone, but particularly young people, from education disruptions to their physical health to their mental well-being. I'm here at Christy Pitts. I'm going to talk to Ocean Ruel, who is a 14-year-old teen. We're going to talk about the impacts the last 2 years have had on his mental health. The last 2 years for young people has been quite interesting. Pandemic, online learning, back and forth, sports and all that. What was the pandemic like for you?
I mean, it was really hard to not see my friends at school because I mainly hang out with them at school and during lunch and breaks and stuff. So I really missed them. I did miss actually seeing them, but I still got to see them online and stuff.
Do you worry that from an educational standpoint, you've actually taken a hit in terms of where you are? You're in grade 9. You got some very big years ahead of you.
Yeah, education did take a really big hit. I don't remember anything from grade 8 math or science, because it was all online and I can't focus when it's school online. So I didn't learn anything in grade 8 or grade 8 in math and science. But being locked up in your house a lot has a big effect on mental health. That was the biggest negative effect for me. I couldn't concentrate or do anything. I was not productive.
What do you think about that sort of connection and relation with social media? What do you say about that connection between our sort of reliance on technology these days and our mental well-being?
I took a break off of the app TikTok for, I think it was, I went a month, I deleted it, and I was going outside more. I was biking with family. It was completely better when I had deleted social media, but I also missed a lot. So I feel like you just have to find the perfect balance between the two.
I'm curious, what did you feel like you missed out on?
There was just a lot of new references and new trends and stuff. So when I went back on and my friends were texting me hey, did you see that new challenge? And I had no idea what it was or anything.
Do you feel like if you shut down TikTok or social media for months at a time that you feel you would be disconnected from your generation of youth?
Definitely, especially since I watch other news sources, but there's also news sources on TikTok, and it just goes directly to you, and it's a better way to spread information.
I was talking to you earlier about a Canadian study, and it was a study that found that transgender youth are more likely than their peers to sort of think about and attempt suicide. What are the mental health challenges for trans youth?
Like, one of the main one is not being able to like reach out to your community much, like, and like playing like an active role in the community. Yes, you can be online, but that's like also really different, especially if you have parents that aren't supporting of you or you're not out yet.
Do you mind if I ask you about that example about your classmate? What was that situation like when that sort of happened?
They're my best friend, so when they came out to me as non-binary, and they told their parents, and it wasn't like a good reaction at all. And I have a lot of extra binders as being a trans person myself, so I asked them if they wanted a binder, and they were so happy when I brought it to them when they said yes. I could tell that that made a big difference on their self-confidence and on themselves, because their parents wouldn't have gotten it for them.
From your perspective as someone who is young, do you think there is enough supports for trans youth, and what would you say are some potential solutions or places that people can go to?
There's definitely not enough like resources for trans youth at schools and stuff. There's a lot of issues with like respecting pronouns at school. And as for resources, I'd say to like, I don't really like helplines and stuff and things like that online.
Why not?
It doesn't feel comfortable to me to talk like to a complete stranger. It has to be someone that I know and trust. But I'd recommend finding someone you trust, probably an adult, and talking to them about it, because they could probably like help you, talk to you, just feel like you have someone that you can just talk to.
During the pandemic, a lot of people have struggled, but mainly young people got sort of the brunt of it. Is there any advice for any other young people that you have in terms of how to cope and how to sort of get through it?
Reach out to someone. It starts by you taking the first step, so you can't like rely on others to come talk to you, ask you how it's doing. You need to find someone that you trust and that is willing to listen.
Hey JJ, how are ya?
Not too bad. I am enjoying the sights and sounds. It's a beautiful day in Toronto.
How did your interview with Ocean go?
The interview with Ocean went well. It's interesting. I never gave my mental health a thought when I was a teen. And when you add in things like social media, which I didn't really have growing up, and then 2 years of pandemic, I don't know how kids are doing it these days.
I've got two kids, 9 and 11, and their mental health during this has been up and down. And as a parent, it's been challenging. And I really don't know if we're going to know the full impact on our mental health for maybe decades to come.
I agree. What are you up to today?
Well, I'm enjoying some rare downtime before I head out to Scarborough. I'm going to be talking to Tara Muldoon and Solitaire from the FU Project. Tara founded the FU Project as a way of having conversations about mental health and forgiveness.
And they work with incarcerated youth, right?
Yeah, and then afterwards I'm going to be catching up with Diana Chan McNally, a frontline community worker here in Toronto, and she's witnessing firsthand how substance abuse and mental well-being intersect.
I'm Tara Muldoon, the founder of the FU Project.
I'm Solitaire, hip-hop artist, as well as member of the FU Project.
Tara, what is the FU Project?
The FU Project stands for Forgive You, Forgive Yourself, and it is a nonprofit that I started 12 years ago now. And myself and the team, we run arts programming, creative writing programming, conversations at schools, correctional facilities, basically anywhere that'll let us in.
One of your objectives is addressing the mental health and well-being of gang-identified youth in custody. How do you do that?
Well, at first we just wanted to listen. What is it that you need? How can we help provide support? And we just wanted to hear what people wanted. Like, how are we here to serve you? And by serving you, how can we support the rehabilitative process? And now we're just like, how are you? And that means more than anything.
It was just as simple as
someone asking them how they were?
So we do a lot of research, a lot of evaluation, a lot of data, and constantly across the board, they say like just a friendly face, that was how people saw us, one consistent caring person coming in and asking them how they're doing. And from there, it just led to bigger conversations. And you know, when you know that if somebody discloses to you that something's going on, then you're able to possibly, hopefully do something that would support their well-being.
So what would you say are some of the common systemic failures that you've seen?
I think one of the systemic issues is not giving enough voice to the backstories. You know, we have conversations and the person that you would least expect to have a brilliant piece of insight, whether it's something that's a current event or just something about the justice system. And it's like, man, I wish, like, how does that brilliance get caught up in this situation? And how do we curb that?
I ran a group yesterday and we talked about patterns in relationships. And one thing that kept coming up, which makes me think about bigger pictures, is abandonment, how they felt so many people have abandoned them since they've been in custody, and before custody they felt like they wanted to be a part of something, so they weren't comfortable with being alone with their thoughts.
It's about showing up and, you know, literally the guys at the end of the session, regardless of whether they participated or not, they'll always shake your hand and say thanks for coming, because you didn't have to come. And those little gestures go such a long way, more than you would ever expect, because these are people that are pretty much abandoned by, some of them by their own family and friends.
We've been having a lot of conversations about generational trauma, and we're learning more about generational trauma. Does the general public really understand what that trauma looks like and how it affects people?
Not even a little bit. This particular group we were working with last week, there was, I think at this point, there was 20 of them in the room, and we had asked them, have you experienced generational trauma in your life? And they were like, no. And the concept of having to identify that something was traumatic in their lives was not something that they were prepared to think about.
And you know, there's a million anecdotes of stories where they'll outright express to you a story that directly shows the trauma that they've gone through, but then they'll start off by saying, like, one guy, he's like, anxiety. He's like, I'm not bad, man. I don't suffer anxiety. That's for soft people. But you know, one day I was standing on the block and I started, you know, cold sweat and my heart started beating and I didn't know what it was. They're like, yeah, that's probably a symptom of the anxiety of like having to be up for 18 hours. And it's like they don't make the connection because their mind is survival. A lot of people who have family that it's like, you know, their brother's in jail, their mother's dead, and they don't know who their father is, and they're raised by their older sibling. There's a lot of kind of sayings, and they call them cliches, but I think their cliches become cliches because it rings true, and it's that hurt people hurt people.
I'm also thinking too, because there's a stigma around mental health. And then there's a stigma of being an offender. So how do you get people to open up, or how do you get people to connect those two dots and see that they need to talk about these things?
This era that we're in is definitely allowed more openness to the idea of mental health being an important thing to kind of pay attention to. So I think there is a little bit more of an awareness, but as you can imagine, there's still the element of not appearing like you're soft or appearing that you're vulnerable in that situation.
With the FU project, you have a certain amount of time to build trust and relationships with these guys. How do you go about that when they are coming from a world that doesn't really value them or doesn't place them first and has repeatedly told them that they're less than? So how do you build that trust in such a short time?
I personally have been really open about my own story, being a survivor of the justice system, a victim through the justice system. I think that they identify and appreciate that somebody can show up who has been on the other side and still wants to be the face of forgiveness or even just moving forward. And then when we show them that FU really is about forgive yourself and how that process can start to change the way that our patterns allow us to move forward in life, I think that that's when we really get them, because self-awareness is still something that I think some of them are still figuring out.
Literally just showing up and asking, you know, it sounds so simple to say, and I mean, it is an investment of time, and you know, we show vulnerability in saying that we're not here to preach, we're not here to give you the answers, but I think that having this conversation, we can generate different perspectives that we can that'll help everybody grow. And it's really just time and perseverance.
What would you say to someone who can't see the connection between forgiveness and mental health? What would you say that connection is?
That's why this whole project exists for me, because I had to forgive myself for things I did when I was angry, and I didn't know I was angry. And it allows me to let things go, not in a way that says, it's okay that these things exist in the world, but more that I don't have to control everything, and I can take my power back by feeling, I'm going to let that go, and I'm going to put that energy back into me and discover what it is that life has for me.
That's another thing that we touch on, is how, emotions are actually take a physical toll. You think about anger as things that you've expressed, but it actually manifests itself physically. So the concept of forgiveness as lifting that weight, and really understanding that, the only way you're going to be able to control your moods and control your triggers is being aware that they are affecting you in a negative way.
My name is Diana Chan McNally, and I'm a housing and homelessness advocate.
That's nice to see you in person.
Nice to meet you as well.
Tell me about the work that you do with the Toronto Drop-In Clinic and All Saints.
We're mainly working with folks who are unhoused, but beyond that, it's not just folks who are experiencing homelessness, it's folks who are low income, living with disability, and otherwise facing lots of different barriers to full participation in society.
The fact that you were doing this work where people had a place to go when other places had shut their doors, what do you think that did for that population?
I think it saved lives. I literally believe that a lot of people are alive because of the work that we were doing. And it's not just about accessing basic resources. It's also about the emotional support that we were providing, giving people a space where they could still connect with community. Anyone who lived through the pandemic, we know that we were cut off socially. That isolation took a huge toll on us emotionally. And so by offering this kind of space to people, we could keep them connected to one another and maintain the connections that they had between workers that they relied upon for their basic needs.
We heard from politicians, policymakers, that frontline workers were heroes. Did you feel like you were being treated like heroes?
Absolutely not. And I think for a large contingent of people who are working in drop-ins, who are working with people experiencing homelessness, we're often some of the lowest paid. Public sector workers. I have folks in my network who make minimum wage, and they're still capped by Bill 124. So that isn't encapsulated at all in the wages people are making. And it happens so often, sadly, that people who are doing this work actually become homeless themselves. Again, because the cost of living is too high. So it is absolutely not lauded as work that is vital to keeping people alive in this city. In fact, we often feel like we're being mistreated by even doing this work.
From the people that you work with, what have you seen in the ways that not having safe housing impacts somebody's mental health?
I mean, it has so much to do with your wellness. If you have housing, you have safety. You have a roof over your head, and you don't have to worry about people harassing you. You don't have to worry about being in a shelter and not just facing a lot of strangers. You don't get to choose who you live with. You're all put together because it's an emergency service. And so there are serious safety concerns for people being brought together with strangers who they don't even know. You don't have to deal with that anymore. You get to set your own hours, your own schedule. You get to eat when you want. In the shelter system, you're not allowed to have food in your own room. If you're living with diabetes, that is a serious health concern that can actually kill you. So a lot of the rules that are actually in place, it's more like a prison. It's carceral in nature than it is like an emergency service. So for people's mental health, it's extremely trying. And I fully understand why people would prefer to live in encampments.
I think a lot of people will be surprised to compare that you've compared shelters to carceral systems, because one of the things that we've been hearing is that the reason why we need to shut down these encampments is that they're not safe, and that we're providing shelters for people who refuse to go to the shelters.
Safety is relative. Mayor Tory, myself, anyone, policymakers, we don't have a right to tell people what is safe or unsafe for them. But shelters are very much like prisons because they're entirely top down. What I've been arguing throughout the pandemic is that we need to give people who live in the shelters the ability to have meaningful input and control over how they are run so that they can actually be made safe according to their standards and their needs. If we look at people who are living outdoors, we have a lot of folks who are either direct survivors of residential schools or the children of people who survive residential schools. And we're asking them to go into a system, a carceral institutional setting, which is reminiscent of a residential school, and to tell them that that's safe for them to be there. It's wrong.
Do you have mental health support for the industry that you work in?
It's limited. For a lot of the folks who are working in this industry, it's not always that available. Not everybody has benefits, and certainly it may not cover what it is that they actually need. Again, we're seeing so many people go on leave. We're seeing so many people who are just leaving the sector altogether. And to be clear, it's not because working with people who are experiencing crisis is what is wearing us down. That's not what burnout is. Burnout is being a worker in the system and trying to fight back against the things that are continually harming the people that we care about. That is what burns people out, not fatigue.
You mentioned to the producer of the show that you've lost some of your colleagues to overdose and that your industry's suffering from collective grief. Can you talk to us a little bit about that?
Yeah, it's been really hard. At this point, I don't know how many people I know who I've worked with, either supervised or, I'm providing services and supports to them. Maybe half the people I know since I started working in this field in 2014, at least, I think have passed away in some capacity or other. So this has really been exacerbated during COVID. There's people that are just missing. This happens all the time.
Like your colleagues are just missing?
No idea where they are. Sometimes you never find out.
I'm so sorry.
It's okay. It's really hard for us to live with that. There's no closure a lot of the time. And for the people who do pass away, we know all of this is preventable. Again, this is what is tiring people, is burning them out, is dealing with this constant death and harm that is being committed to the communities that we care about, that we belong to as well. And knowing that none of this needs to happen. It could change, again, if we had the political will and the right kinds of policies in place. I've lost 3 of my employees just last year. All 3 of them overdosed. Wonderful, lovely people, and everybody I know who's doing this work continues to lose somebody, sometimes every day, sometimes every week, and it's too much.
Ontario has experienced a rise in overdoses in the last 2 years, and there is growing evidence that suggests a connection between those harms and people experiencing mental health disorders. Combined with isolation, reduced access to health care, it's created what some have called a shadow pandemic. We're back at TVO to start a live online discussion on what needs to be done on the ground to reduce harm, how to help people with their addictions, and what policies are needed to alleviate the situation. This month's topic contains important but sensitive discussions around mental health and drug use and addiction. For more information on crisis resources and supports available to you, visit CAMH, Centre for Addiction and Mental Health, or the Canadian Centre on Substance Use and Addiction. Even before the pandemic, opioid-related deaths were already at a crisis point, but COVID-19 restrictions led to isolation and less opportunity to access healthcare and community services. From February 2020 to December 2020, the Office of the Chief Coroner in Ontario reported a 78% increase in opioid-related deaths. Today, we want to take a closer look at the people behind the numbers and the emergency that's been happening in Canadian communities for decades now. We want you, our online audience, to join the conversation. Whether you have a question for one of our guests, a comment, or a story to share, we want to hear from you. Today, we have a panel of voices who are pushing for change and action. Let's have them introduce themselves.
Hi, I'm Debbie Reed. I lost my son to an opioid overdose in March of 2022. I'm Johnny's mom.
Debbie, thank you so much for being on the program, and our condolences. Crystal, please go next.
My name is Crystal Kimawan. I am a frontline social worker I also identify as a peer, so a person who has a lived experience with substance use. And through the pandemic, I too, I lost my partner last year in April to overdose.
Our condolences to you as well, Crystal. Thank you so much for being on the program. And Benjamin, could you introduce yourself next, please?
Yeah, hi. My name is Ben Perrin. I'm a law professor at the University of British Columbia in Vancouver. I'm also the author of a book called Overdose, Heartbreak and Hope in Canada's Opioid Crisis. And I just wanted to also just recognize Debbie and Crystal. Thank you for being here. And I'm also very sorry for your loss.
So Benjamin, I'll start with you. So in April of 2020, you co-wrote a column for the National Post with Jordan Westfall, and the column was called A Perfect Storm, COVID-19 and the Opioid Crisis. And you wrote, quote, unfortunately, the best public health advice for responding to the opioid crisis is the precise opposite of that for COVID-19. That was really early on in the pandemic. It was the second month of pandemic rules in Canada. How were you able to recognize back then what would transpire with what is now being called a shadow pandemic?
It starts with the idea that we needed to isolate and separate from each other for COVID, while what we need to do to address substance use and particularly overdose deaths is to not isolate. The top level advice for people who use substances to not use alone. And all the harm reduction measures and approaches, things like overdose prevention sites, those were either shut down or had their hours curtailed. We saw that the street drug supply get even more volatile and contaminated. And so many of the things that we needed to do to save lives during the opioid public health emergency, which still has not been declared in the province of Ontario, despite killing thousands of people, was the opposite. And the numbers bear that out tragically, and it has still not been addressed.
And one more question, to give us a better understanding of what it is that we're talking about. Can you give us an overview of what opioids are and why they're so addictive?
So opioids are a type of drug which is essentially used to relieve pain. And there are naturally occurring opioids like heroin, people have no doubt heard of, but there also are synthetic opioids, which means that they're made in a lab. And in Canada today, we have a contaminated street drug supply. And so the reason why this contamination is driving this is that we're talking about a synthetic street drug like fentanyl, and you're talking about a substance which is substantially more potent than naturally occurring heroin. And so we're talking about literally grains of sand being the difference between a lethal and a non-lethal dose. And of course, it varies completely depending on someone's substance use profile.
In your work as a peer support worker, what have you noticed about the difference in available resources to help people?
Sudbury has a long way to go. I know we look to BC a lot and we rely on what's coming about in British Columbia. There are a lot of culturally specific services available to community members that Sudbury just does not have. Experiencing discrimination, racism within our healthcare system here in Sudbury is very real. You know, we've seen 132% increase within the first year of pandemic of Indigenous opioid-related overdoses and deaths. 68%, this is just within Ontario. A lot of our frontline workers that were active in the height of the pandemic and restrictions were burnt out. Resources for us as helpers were non-existent as well. So we were facing in a continuous cycle of grief and trying to support community members, parents who were losing children, partners losing their partners. It was, I don't even know how a lot of us made it through.
Debbie, as you were listening to Crystal talked about these are not just numbers, these are people, these are mothers, these are sons, these family members, these are individuals. What happened to your son?
My son was medically addicted. He had an accident. He had 2 accidents in the first year. He did have many years of recovery, but he had a trauma in his life, a breakup. He and his partner, 2 children, and he went straight back into the bowels of addiction. And this time he went into using fentanyl. So a lot happened. It was really a year and a half of tragedy. watching him turn into somebody that was completely unrecognizable to me. That type of behavior inevitably sort of aligns with criminal behavior, and he got into a high-speed chase with the police. He was impaired. I saw it as an opportunity to get him off that fentanyl. Nobody ever wants to think, great, my kid's going to jail, but I did go to see the district attorney and said to her, please, this might be the only chance that he has to live. Please keep him in here. And they did. And he suffered horribly in the prison. The numbers were off the charts. They were understaffed. It was a horrible place to be. After about 6 months, he was starting to do his recovery talk again, and I let him out of jail. I provided surety for him, and he bounced me at the mall. And 2 days later, he passed away at the Thunder Bay Emergency General Hospital. He overdosed while he was in the hospital. He must have. He just died behind a curtain and nobody noticed, with all the life-saving supports around him, and nobody noticed. This is a terrible disease, and it goes against the laws of nature.
Thank you, Debbie, for sharing everything that you've shared. I know it's very traumatic to talk about this, and we really do appreciate you sharing what happened with your son, Johnny. Crystal, people making decisions wait on stats that are slow to come to light. What has to happen to engage more people who can make decisions about providing more resources at exactly the time that they're needed?
I think really bringing it back to the real lived stories like that of Debbie and sharing her story. Yes, the fentanyl and the drug supply is much more lethal. Let's focus on that and shift our focus. No, it just needs to be a collective measure in how we go about addressing this crisis. And it is a crisis. What is it going to take?
You brought up so many great points, Crystal, and one of the points that I wanted to follow up with, Ben, is that before the pandemic, we would hear that governments can't do X, Y, Z because it's impossible or it can't be done. But during the pandemic, we saw that governments could do things that have never been done before. We know the government can fund a pandemic, Ben. Can we assume if the will was there, they'd come up for with more resources for what's happening with the opioid crisis?
Absolutely, but it's really not even a matter of resources at all. We know from the research that investing every dollar, for example, invested in treatment and recovery saves up to $12 in healthcare and criminal justice expenses. So this is actually not even a question about, oh, we don't have enough money. It's a lack of political will. Those who the decision makers are primarily listening to on this issue, because they're not listening to people who use drugs, they're not listening to public health officials, they're not listening to Indigenous advocates, they're listening to voters. And it's people like conservative leadership candidate Pierre Poilievre, who was out just this month saying that the solution to this problem is to more of the same, cracking down in a criminal justice response. We've also seen premiers in Alberta and Ontario actively opposing life-saving harm reduction measures like overdose prevention sites. So it's about politics. This is not about money.
And Ben, last month, British Columbia became the first jurisdiction in Canada to legally allow people to carry up to 2.5 grams of illicit drugs. What's the difference between decriminalization and legalization, and why was this move important?
Yeah, so first off, legalization is what we currently have in Canada with, alcohol and cigarettes and cannabis. So anyone who's over a certain age can legally go and purchase a certain quantity. The products are regulated, you know what's in them, and there's health and safety checks and stuff that are kind of built in. Decriminalization is different than that. Decriminalization simply means if you have a substance, we're not going to ask where you got it. We're not going to necessarily provide it to you legally. But if you have that substance, you're not going to be liable to criminal conviction and prosecution. So it just basically says we're going to leave you alone. That's decriminalization. And so the reason why decriminalizing people who use drugs is one part, there's nothing here that's the whole solution, but it's one part of what needs to be done, is that it will begin shift things from being treating as a criminal law issue. The idea that if we punish you and sanction you, that will somehow help you stop using. We know that that's not true. And so I've spoken with people. Part of my research for a new study involves speaking with folks with lived experience in the criminal justice system. And in some provinces, upwards of half of everyone who has died of overdose was recently spent time in custody. And so for many people who use substances, spending their time in prison because they're not given the support by the system after they're released, in many cases it is a death sentence for them. And so we need to take the criminalization of people who use drugs out of the picture, and instead we need to replace it with a compassionate, evidence-based approach, one that supports the well-being of people in a much more holistic way.
Crystal, part of this conversation has been to have a safe drug supply. Do you think that a safe supply is needed to prevent death and to curb what's happening right now with the opioid crisis?
Definitely, yes. I know, again, because I have some experience within Toronto, we do have a select few doctors who do prescribe synthetic, Dilaudid for opiate users. It is a controlled drug supply. It is keeping people alive versus having to acquire their drug of choice on the street. So yes, does it save lives? Does it keep our community members alive? Yes, it does. And is it needed? Yes.
Having a safe supply put in place gives the people on the ground an opportunity to have that conversation. It's just essential. Connection is the opposite of addiction.
Ben, when we're talking about this, it seems as if there's so much to unpack around what's happening with the opioid crisis. In your book, you said, I hope that one day in my lifetime, there'll be a public inquiry into the opioid crisis. Do you think that will ever happen?
I think there needs to be accountability, and there has to be. Whenever you have tens of thousands of people dying, and there is evidence to show what could help save lives, and decision makers choose not to follow that evidence, there needs to be accountability.
I wish we had more time to talk about this. I do want to thank Crystal and Debbie for speaking to us about your lived experience and about the pain that you've had to go through. That is a lot of emotional labor, and we do appreciate you being on the show and sharing that with us. And hopefully this is the beginning of a conversation people need to have more with their family and friends. And Ben, I'm looking forward to speaking to you later on in the summer on TVO. Thank you all for being on the program. We appreciate it. And thank you to everybody who tuned in on Zoom. We appreciate that as well.
Thank you for joining us for this conversation. We know there's a lot of emotional labor behind it, and we appreciate everybody's time. As always, you can follow us on TVO The Thread on Instagram. We'll see you next time.